Welcome back, everybody. We will pivot to our next section in just a moment. You can actually go ahead and stop the screen sharing now because we're going to pivot next to Brady and our open mic session. So as folks are trickling back in, get settled and get your phones ready. That's one way to interact with this exercise is with your smartphone. Brady, are you with me?
Yes, I'm here. I'm just getting set up, doing some background work here.
Great. So I think the breakout rooms they're all closed now because folks are flooded back in. Great.
Awesome. So I'm going to kind of navigate us to our Minimeter activity, everybody. And then Michael, if you want to do some extra framing just around the question, I think that would be helpful.
Yes, as I said at the beginning in my framing remarks, there is time and space to wallow in the despair of injustice, and that is, I think, valuable on its own right. But we also want to focus today on constructive solutions in support of non-punitive responses to homelessness. So that's sort of the question: is what is working in your community in pursuit of alternatives to policing, non-punitive responses to homelessness? So Brady, tell us how this works.
Yeah, so at the moment, I've got instructions for how to actually get to our Minimeter interactivity here. If you are using your phone, you can just scan that QR code and it will pop you right in to the program, and you should see exactly what you see on your shared Zoom screen. If you are going to use your computer, there are instructions on here as well. So you can go to minty.com and then enter our code 45210865. And it is really helpful if you press the little thumbs up icon, just so I kind of know how many people are in the room. Give everybody just a couple more moments to get logged in. And even if I move on before you are ready, we'll have the instructions at the top of the screen for how to get to Minimeter as well.
Excuse me, do I have to leave the session in order to get to put in the www?
No, you
closing you out?
No, you should be able to leave the Zoom screen open and then just pull up the internet browser in a separate window.
If you say so.
Leaving you, Mary Louise.
I'm so sorry that I'm so dense.
No, you're not.
No,
separate tab.
Yes, if you need to, you can also just kind of interact in the chat. If you
That's great.
Submissions.
Okay, I think that's probably best. I don't.
Yeah, no, absolutely. We are a barrier-free group here. It works best for you. Okay,
yeah,
I'm gonna go ahead and
I just wanted to say, excuse me. I just wanted to say that I did go through Mentimeter and I put the numbers in and I see exactly what your screen is saying now. So am I good?
You've done the right thing.
Okay, so I'm just asking because other people might be having that problem and think they need to do something else.
yes, no, you should see exactly what I have on our shared screen. And I'm going to go ahead and move on, and then we're going to, hopefully that'll prove that everybody is good to go. So before we begin, I just want to give a couple of heads up on our activity that we're about to do. Every time you do a submission, you are only allowed 250 characters, and we kind of realize this is a broad, very important topic, so you might have more to say than that, but we do have it set up where you can do multiple submissions. So just keep that in mind. You're not limited to just one answer. And then if you are comfortable being identified and your answer being tied to you, please include your organization or your name in your answer so that we can, again, connect those dots, because Mentimeter is inherently anonymous to begin with. So here we go. We are ready for our question.
So if you start typing, especially if you're doing this on your phone, it'll start appearing on the screen if everything is working correctly. And this is a challenge to see how you can describe constructive solutions in fewer than 250 characters. I appreciate that the first comments we have are reflective of our initial survey that we showed before about how we don't really know. Interesting. So cahoots, we've got folks in Eugene. Welcome. Harm reduction approach when working with youth. Sanctioned encampments. I want to hear more about that. So we've got some homeless outreach team officers, part of the COC. That's interesting. Navigators, crisis response vans. Having law enforcement being all involved in coordinated entry. Got CARES in Madison. Appreciate the sentiment that very few options actually seem to work. I hear that. Homelessness is still on the rise as one indicator of that. New housing opportunities that are desirable to people who actively use drugs. Harm reduction centered non-congregate housing options. Mental health first aid. Housing. Yeah. Getting folks into stable housing certainly reduces their interactions related to living unhoused with the police. Just do this for another couple of minutes. And I believe, Brady, we'll be able to download this somehow, right, to share.
Yes, yeah, we'll have an Excel spreadsheet of all the responses.
Cool. So lots more on diversion programs, street medicine, citing, and police briefings about homelessness violations. Great. Well, it looks like the thing isn't continuing to scroll. So I appreciate everybody's interaction with this activity. We thought it was risky to actually unmute everybody to do a true open mic when we saw that 1,000 people had registered. So that's really great. If we could transition to the PowerPoint again, we will get to our next parts of the agenda and then wrap up. So the next thing I need you to do for me, because as I said, we're using federal funds for this, so we got to evaluate it. And also I'm curious what you think. This is going to be anonymous, but we are going to use a Zoom poll to get just your responses to the overall experience today. It's just 3 questions. If Brandon, if you can go ahead and launch that for us. And I'm going to be silent for 60 seconds as you answer these questions. So 10 more seconds to complete the poll for us. Okay, thank you, everybody. Brandon, you can close that poll and not share the results. Those are for later for us. And if you can also go to the next slide. Brandon's doing a lot for us, so 3 cheers for Brandon, if you don't mind. If you were with me in the crisis assistance track, if you will, you may be especially interested to hear that the National Healthcare for the Homeless Council is launching a learning collaborative, a peer learning community is another way of saying that. Really just working with health centers in particular, but other community partners that are necessary to development of anything kind of like Cahoots. We're gonna bring us together and work together to figure out our shared issues and identify solutions wherever possible. We want more Cahoots in the world, and the council is anxious to figure out how we can be supportive of that. So applications are open for that by April, before April 30th. And we'll put the link to that in the chat box as well. Yes, the link will not be working on the slide itself that we're sharing. Next slide, please. So we do have some upcoming events here at the National Healthcare for the Homeless Council. We can't believe that we are meeting in person. What the heck? Remember that? It's been a couple of years since we've done that. Our national conference is coming up in a few weeks in the Seattle area, and I hope that you consider joining. I also want to shout out the Street Medicicne Institute's annual symposium, which is going to be in Toronto this year in September. I believe the call for proposals is open through this Friday. And then our friends at the National Homelessness Law Center are going to host their annual forum on the human right to housing, and are interested in your feedback on whether it should take place virtually or in person. So there's some information there about that. I'll go ahead and add these links to the chat as well. And I think that's going to be our last slide is the next one. I just want to reiterate my gratitude for you showing up in this space, for being so committed to the mission that we all find ourselves a part of, even if we do disagree, as we've probably encountered some disagreements in our workshops. I'm grateful that we all seem to be committed to human dignity and ending homelessness. So we are actually going to wrap up with some extra time to spare today. We'll go ahead and leave the room open so we can dump a bunch more of the links in the chat box, but I'm going to say farewell and thank you for attending today.
Thank you very much, Michael.